So I'm actually going to start at 12:03 here. We've got probably half the class, and that's fine. This is being recorded for the benefit of those who can't make it. Hope everybody's well.
Professor Nick, Jenny's going to be a few minutes late. She's just finishing up her lunch.
Yeah, all good. And don't hesitate to just log on and munch on your lunch. That's fine as well. Don't, I would hate missing class for nosh when you can nosh during class, and I don't mind as long as, your little eye contact always makes it helpful. So just some administrative issues first. So Chat GPT is like this huge topic, which is the artificial intelligence search engine / it'll write your paper for you in academic circles. How many people have heard of Chat GPT? Wow, you guys are in for a radical transformation of education, work, our lives. So Chat GPT is supposed to put Google out of business. I think Chat GPT is Microsoft, but Apple and Google are just spending billions trying to make sure they get it. And instead of just Googling a search, you put in a question or a query, and it through AI, it's completely AI driven. It will literally write code for you. It'll write your paper, write a paper about the comparison of healthcare systems in Zimbabwe versus Ghana, and it'll send you the paper. So it's like this gigantic issue of academic integrity and, whether this violates rules of plagiarism and I mean, just a million different things. Now, for the longest time, you've been able to buy papers on whatever you want. There's websites out there, you buy your paper, obviously violating academic integrity and plagiarism rules. I really don't care. I mean, I care. I think academic integrity is important, but what I want is you guys to understand the material. Let's talk about it. Let's explore it. Let's make sure we feel comfortable with it. And there's all sorts of articles. There's a huge campus meeting, I think in March for Colby Sawyer, about Chat GPT and the implications. And there's two schools of thought. So there's one school of thought that, this is the worst thing that ever happened and completely undermines people's independent thought and will just encourage plagiarism and violations of the academic code and blah, 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 blah. And then there's another camp that says, wow, this is an amazing opportunity to learn. Where do you guys come out on this? This is important because you are literally going to be using artificial intelligence, search engines, and answers to questions for the rest of your lives. You heard it here first. So, the devil or the angel?
I wouldn't want to use it. Oh, I'm sorry, Monica.
No, that's okay. Go on. Go on.
I don't know. I think people should just do their own work.
Okay, great.
I don't know. I like to write.
I think it's a great answer, and there's two completely different schools of thought.
You learn more if you're writing your own paper and doing your own research, because then I think you're questioned about it. You can answer it if you're doing it yourself. Because that's the whole point.
You might wonder why I'm having everybody do their own presentation.
Yeah, so we did it.
Yeah, no, exactly. That's exactly so. So you're already sort of getting a leaning of where I fall on this. I think Monica had a comment.
I was gonna say it can be both. I think it's inevitable. This is gonna happen either now or later as AI advances. But you can use it however you want to. You can make it a good thing where it's a learning, where you learn from it and utilize it positively, or you can just copy it and people can't track that because you just can't track it, and it can be bad as well. But
so it's so funny. There's a guy, I think the student was at Princeton. He created an algorithm to analyze papers and programming to see if it was created by AI and Chat GPT, and he was successful 90% of the time. So for all the software out there, and thanks, Monica, for your absolutely balanced approach, pros and cons. So you actually can identify if it's Chat GPT. One of the reasons that there's so many articles on this now, it's really interesting. And again, I'm only bringing it up not because as much as it's a public health issue, but it's going to be an issue you guys face in school for whatever remainder you have, but in your career. So if you can have, if you're, let's fast forward 2 years, even for those of you who are juniors, you're out in your job and you're asked to perform a task and do a memorandum or report on something, and you can spend whatever, 20 hours, half of a week, you're researching it, writing it, and it's a complex topic, and your report, your memo is going to be, decent, you're going to, it'll reflect 20 hours worth of work, and that's fine. But you can hit chat GPT, and in less than 5 seconds, it'll give you a really thorough and comprehensive report for your employer. That's articulate, well written, better than you can write it. Because I'm not the world's greatest writer. What do you do? Do you tell your employer, I'm using chat GPT, I've fact checked it, I've reviewed it, it seems accurate, I've looked at its sources? Or do you say, I'm going to do this on my own? Or do you ask permission?
I feel like just like every other like visualization service or like other reporting tools that people use in their everyday professions, like I feel like it would be a benefit, like of benefit to like have this sound tool that like generates professional reports. I mean, just like any other thing, like we use like EasyBib. What's the difference between that and the AI service?
Yeah, so there are already existing websites that you can just take Wikipedia, put the entire Wikipedia website into it. It changes all the words so you can't tell that it's plagiarized, and now you submit it as your own. So this has been out there forever. Anybody else? Or cool. So here's what I'm going to ask you to do. I want you to use ChatGPT. I want you to query your question and use it as a resource, see what it cites. It's a research tool to me. I'm telling you specifically, do not submit what it says, but research it, look at it. If it has something valuable that teaches you something, that's a wonderful thing. That's not a bad thing. So it's all about your intent. If your intent is to educate yourself and to find out what's out there, and it can be done faster. I mean, it's like me requiring you to do your multiplication on a math exam or your division longhand so I can see that you understand it versus using a calculator. As long as you're getting you understand the principles and you're getting the right answer, and it can be done infinitely quicker than doing it longhand, I think it's just an amazing vehicle. And again, there's a whole school of thought that this is just an amazing opportunity to learn. So I'm going to ask you to use it. If you don't want to, don't. But I'm giving you free permission to look at it. You may find resources and citations and references in there that you weren't able to find on your own. Why wouldn't you take advantage? It's like going to a librarian, or cyber librarian, or cybrarian, I think is what they're called now, and saying, hey, can you help me research this topic? They're not giving you the answer. They're helping you to research the topic. And that's the way I view this. So if we can all sort of advance our problem solving by using AI, by all means use it. I think it's just a great idea without any endorsement of plagiarism or copying or submitting the materials. So just use it as a super advanced Google search, opportunity to find out information on your topic. And I'd be very curious for you guys to, give me feedback on what your experience is with it. I mean, I've only used it a couple of times, but it writes poetry, it writes code, it writes papers, it does everything. It'll give you a haiku on Valentine's Day, and a pretty good one. There's already been research that it gets like a B or B- for passing Wharton Business School. So it's an effective tool, and if you can use it to educate yourselves, that's a good thing. That's not a bad thing. As long as you're not just lifting it. But people have lifted stuff forever, so and that's why the whole I'm blanking on it. What's the software that you guys use for? I've used it before for the plagiarism that gives you a score. I'm not using it for this class.
Turnitin or something?
Turn it in. Thank you so much. Yeah, thanks, Kylie. Turnitin. So, people have been using Turnitin for forever. I think it's going to be, I think it's going to be put out of business, to be honest with you. It just doesn't make any sense. I mean, how Turnitin going to then figure out whether you use ChatGPT or not? I mean, they'll be able to, but what will it mean? I mean, the key is that you understand critical thinking and problem solving. So, and that's again, you know, I set up this course recognizing that ChatGPT was out there, recognizing that there are all sorts of resources. And that's why I get weekly updates from you on where you're going with this, what you found out, what's interesting to you. I asked for a draft. I'm going to review the draft with you. And then ultimately, you know, how can you plagiarize if you're asked to do a presentation and the class is going to ask you questions about it? So I just thought it was a topic worth discussing because again, I'll be dead and buried and you guys will be using it for the next 50 or 60 years. So, you know, enjoy it, use it. It's another tool. And, you know, it's all about all the tools that we have and the technology we have. It's all about how you use them and what your intent is. So that I just wanted to chat about that. And again, I'd love feedback as well. So the assignment for your course evaluation is great because you get 100 whether you bash me or whether you say it's a good class. So as a matter of fact, I may prefer, you know, constructive criticism more than I prefer pats on the back, because that just makes it a better course. So I've only gotten one person to submit that and they already got 100. Everybody's going to get 100 because again, it's all, and then I'll probably next week just give you some feedback on what if there's a consensus on either changing the course or improving it one way or another. And again, for those of you who are here, because it's a mandatory class, so be it. I apologize that it's a mandatory class. Not my hunt, not yours. Both of us are. I'm required to teach it. You guys are required to listen to me. Everybody's pretty much submitted every assignment, and I've graded every one of the assignments. I want to just tell you right up front that if for any reason I try to give feedback, whether you get 100 or whether you get an 85 or an 80, as to, you know, why you got that. So if you want to resubmit it and answer my queries, because a bunch of times I put queries in, feel free to do so, and I'm happy to regrade it. You've got to email me so I know that you resubmitted it. You know, the questions are 40% of your grade, so it's actually kind of important. But if, you know, you're super grade conscious and you really want to keep your GPA at the highest possible level and you want to resubmit them, it's all about learning. It's not how many times you submit it. It's about critical thinking and learning. So that's totally cool. I'm not a huge fan on babysitting, so I think only one of all the assignments and stuff has not been submitted. Otherwise, everyone has been submitted. So unless you specifically want me to say, hey, I didn't get your answers to this and such a question, it's just so easy on Moodle to look to see whether, you know, the assignment is in, whether I graded it, whether I commented on it. And for those of you who want more comments, please let me know. So one of the topics that I haven't covered, for those of you who have looked forward, that's kind of a social determinant of health, and frankly, other than nutrition, probably the biggest influencer on long-term health and well-being is exercise. The data on it is massive. That how important, you know, even the smallest amount of exercises are, as we all sit here doing nothing, looking at a screen. But it's just real. There's a ton of literature on it. So if it's a topic you're interested in, and because we do have some TBDs and we do have some classes where, you know, we can add additional stuff, let me know. We're missing 4 people. I only heard from 1. That's unfortunate. I think that's it for admin type stuff. Let's go around the room, especially since we're missing a third of the class, and tell me what was of interest to you. We can talk about it briefly, and then give me a brief update on your topic and something new or different that you learned as you're researching it week by week. We're halfway through the period of time for you to submit your draft. So, you know, we're at week 5, week 10, you submit your draft. I'm just asking you to keep that frame of reference in mind, because honestly, in the next probably 2 weeks, you should have a pretty distinct outline of what you're going to be writing and drafting. And at any time that you're interested in chatting with me and, how should I do this? How should I present this? It only just makes it easier for me to give you constructive criticism or just support for what you're doing and how you're doing it. So please don't hesitate to reach out to me. I'm only available 24/7 on Zoom. So if you're a night owl, I'm yours. If you wake up at 5 o'clock in the morning, I'm yours. And that's great. But one thing I do want to mention is for those of you who think this is a pretty cool class and are enjoying it, that's great. Listen, for those of you who don't, you can ignore the next few comments. I'm happy to mentor you guys. I'm happy to be a reference and a resource for you guys. You guys are most of you are almost in the next, 12 months are going to be applying for jobs and stuff. My concept is if you like the class and you want some mentoring and career development concepts, use the school first, but you're still going to always need references. I'm happy to chat with you. My philosophy on references and writing letters of recommendation is the following. You write the letter of recommendation, I slightly edit it and sign it and send it on. So you can get what you want out of this. I want to be helpful. I want to help you with your careers. I want to help you with your learning. And if that's something you want to take advantage of, by all means, mentoring, job, career advice / letters of recommendation. So just, again, reach out. I'm really hard to reach. You have my cell phone, you have my email. So yeah, let's just go around the room. I'll just let you, there's only 9 people, so just go for it. Topics of interest and update on your paper. Not all at once. No.
A couple of topics. It was in the Wall Street Journal. There's an article about teen girls experience record level of sadness and suicide risk. I thought that it was interesting because of everything that's happened. It's no surprise that there are higher risk.
Yeah, so a great topic, and it's been all over both Kaiser and Wall Street Journal, and I think the New York Times. Everybody covered it because they said there's a 60% increase in teen depression and anxiety. I reflect on that. I don't know what the answer is, and I don't know what the cause is, but I have some strong suspicions. And there recently a 14-year-old committed suicide after being beaten up. I think that was New Jersey. What state was that in?
I don't know, but the article, like underneath it, like just quickly, it was a lot of like teen girls engulfed in violence and trauma. So
Yeah.
It's not funny, but funny that they're like back to back on the Kaiser Health.
Yeah, the superintendent of schools there resigned. He blamed her. He said that her parents got divorced, and that was the reason why she committed suicide. And again, there's these viral videos of students just beating the crap out of her. I mean, she had a concussion. She was unconscious. They showed pictures of her bruised, her arms and legs bruised. They show pictures. I didn't see this. My mom referred to me. She said there were like multiple people just walking by as people are kicking the crap out of this poor girl. And so and then I think the superintendent of schools, who again, thank God he had the good sense to resign, said that she had a substance abuse problem and it was the parents who were at fault. You can't make this crap up. You really cannot make this stuff up. So he had the good sense to resign. He would have been vilified and terminated. So he made a polite exit after those ridiculous comments. Talk about blaming the victim, just heinous. I would love your thoughts on what you think is the reason for this.
I think because people were locked up for so long that there's that built up kind of activity levels and stuff and so like they're
certainly COVID didn't help the situation. Anything else that's been changing over the course of the past 5 to 10 years in your lifetimes since you've been 12 till now? You're
social media and people.
Oh my God, I think social media.
Nice.
Yeah, I think social media is a disaster in terms of making people feel isolated and victimized and trolled. And I mean, it's just scary. So any other thoughts on it?
I mean, from a personal aspect, not too long ago, like a couple months ago, my high school, there was a couple fights that the principal had to get involved, and like everyone's first reaction was to like video it instead of like help. And that's everyone's like, oh, let me not help the kids that are fighting, let me videotape it and share it, like show everyone. Which is just, it's the way that the world is happening right now. Like people are so involved on like their phones and stuff that they're not worried about helping people. They're more worried about their.
Yeah, this is a topic. Yeah, I couldn't agree with you more, Madeline. This is a topic of first expression because none of this existed. I mean, since when was your worth determined by your followers? Since when was your value as a member of a society or community based on how many likes and but I mean on Instagram, I mean there are people like, oh, I wouldn't associate with them. They only have 100 Instagram followers. Again, there's a lot of craziness out there. It's all a first impression type stuff. So I don't know what the answer is. I just think we need to sort of evolve into a more collegial, kind, friendly, and supportive environment. I mean, when I was a kid, there was no such thing as bullying. I mean, yeah, there were the nerds and the jocks and stuff, but I mean, you weren't, people might have like sort of categorized you a little bit, but now it's horrible. I mean, there was that woman in Massachusetts who was dating some guy and basically kept telling him to kill himself until he finally killed himself, and she was held liable for it. She literally said, "Stop complaining and just kill yourself." I mean, they're literally text messages. And
well, that's right before you said that, I was thinking of like, wasn't there a case that like a girlfriend was pretty much saying like, kill yourself, you're not worth it.
Oh yeah, we're thinking about the same case. It's insane. I mean, again, if anybody said to me, hey, Nick, when you're 63, you're going to be reading about cases like this, I'll go, no, unless Orwellian dystopia is the reality of our lives, there's no way this could ever happen. And it's just happening every day. So yeah, great topic. I couldn't agree with you more. How's your paper going?
It's going. I'm looking like at different like countries stuff now. I'm like diving a little bit deeper and finding.
Remind us what your topic is, because I honestly don't even remember.
PFAS and water.
Oh yeah, you were going to put it in the water. Yeah. First it was ceramics and or cookware.
Cookware,
in the water. Yeah. I think, as I've already told you, I'm biased toward comparing how other countries deal with it, because it gives you a much broader, different social construct of how people are going to solve the problem and what the best way to solve it is. So. Yeah, and did you read anything in any particular article that you found interesting about either how other countries are dealing with it? As you notice, I'm going to hold your feet to the fire because I'm hoping you're spending at least an hour or two doing the paper part of this every week.
Yeah, I mean, my head's kind of just like heavy right now. Like I definitely did some research over the weekend, but now I'm like, as soon as you ask me, I'm like, what'd you do? I'm like, out the window.
So that's perfect. I'm glad you brought that up, Madeline. So everybody be prepared. I'm gonna hold your feet a little bit to the fire just to make it easier for you, because in 5 weeks you're gonna need a draft. So I'm gonna hold your feet to the fire so that when you read something of interest, just make a little mark of it, because when I ask you, I'm gonna ask you to comment on, what was the one, did you have a pearl of information or did you learn something new? So that thanks for that point, Madeline. Anybody else on topic of interest and update on your paper? Start with your topic of interest, please.
I can go next.
Oh, thanks.
So, something that was really interesting to me on Kaiser was this was on yesterday's news that doctors are now like disappearing from emergency rooms to reduce cuts. And that's more just going to be nurse practitioners and physician assistants and like other staffs who like don't get paid as much compared to doctors, which I found that to be like interesting. That they're trying to avoid like the doctor route with everything.
Yeah, so we actually have a class. Hang on, I'm going to find it, because I think that's just a fascinating topic. I'm sorry if every time you guys bring up a topic, I say it's interesting, but I find them all interesting. And this one in particular is just super cool. And I chose it as a, I'm going to find the darn thing. Oh yeah, here we go. So if you look at week 9, Jenny, week 9 is advanced clinical practice in the UK, scope creep, safety or financial issues, scope creep, problem or solution. So when I talk about scope creep, it's not having doctors there, but having advanced clinical providers there. I use the word advanced clinical provider. There's a million different names for it. I don't like the pejorative names like mid-level or whatever. I like advanced clinical providers. They're not doctors, but they're advanced clinical providers, whether it be nurse practitioners or PAs or or other. It's all good. So we are going to have a chance to explore that in greater depth. What's your gut feeling about it? Solution or problem?
I guess it could really go like either way, because I've never really I've like seen a nurse practitioner in more of like an urgent care setting, which I think that's more like beneficial to have the PAs and like nurse practitioners there. But like, what's a nurse practitioner gonna do if like in the situation that like you're in the ER and let's say you're having signs of a heart attack and then you just like drop dead? Like, I mean, I know that's very hypothetical, but like I feel like there needs to be more of like an action plan like implemented.
So I think you literally hit all the high points of whatever I would have said about the topic as well. So what percentage, so I'll just challenge you a little bit, what percentage of ER visits are true emergencies, like emergent, life-threatening or limb-threatening?
I'll guess like a good like 45%, maybe.
It's more like 20%. It's actually a small, no, how would you know that? Yeah, the vast majority of people who go to ERs don't need to be in an ER. I mean, it's a $2,000 or $1,500 expense. And, you know, I've had people come in at 2:00 in the morning with kids with runny noses. And I'm like, why are you here at 2:00 in the morning? Well, the lines are shorter. How long has your child had a runny nose? Oh, 6 months. Glad you're here. No, we'll save your life now. We'll cure that runny nose. So there's a lot of really inappropriate use of healthcare resources. So I'm trying to remember if it was my son or my daughter. It was my son. We were skiing. He sprained his wrist. He said it was very painful. I took him to the ER. He was seen by, I don't know if it was an NP or a PA. Whoever he was seeing, it was an ER person, but not a non-physician. The physician came in, did his assessment after she had seen him. They did an x-ray. There was no fracture. He was splinted and sent home. Do you need a board certified ER doctor to do what she did?
No, well, I think in that situation when it's like more of a simple case, like I perfectly think that like a PA can do something like that. Like when I had a concussion last year and I tried to go to urgent care before going to the ER because I knew it wasn't bad, but I just wanted to make sure my diagnosis was right. So, and I tried to go into the urgent care and they're like, no, your symptoms are a lot worse than they are. Like, we are sending you to the ER. And I was like, great. And even like the whole time I was in triage, a PA was treating me the whole time, which I was like, okay, like I knew it was a concussion. Like I was even explaining to them, I tried to go to urgent care before going here because I was like, I work in healthcare. Like I get you guys are very low staffed. Like I'm trying to cause you guys less pain, but they forced me to come here.
Yeah, no, you just described a very typical scenario, and you're absolutely right. And is a concussion protocol something that you need a board certified emergency room doctor for?
I guess it's really depending on how bad. Like if your concussion is severe, I would go like board route of like a doctor. But if it's like a mild one, I think like a diagnosis from like a PA or a nurse practitioner would be fine.
Yeah, so the beauty of it is you can go in an urgent care, anybody can evaluate you. They'll go through the protocol. Oh, this looks like a severe concussion. We're sending you to the ER. Oh, the vast majority of concussions are not severe. Here's your head sheet. If you have progressive headaches, if you have nausea and vomiting, if you feel sleepy, you need to go back to the ER right away. If not, you just monitor it closely and keep in touch with us. We'll give you a follow-up call tomorrow. So yeah, it's the vast majority of the stuff that we're dealing with is stuff that can be dealt with advanced clinical providers, especially if they have subspecialty training. So that's cool. And your paper?
So for my topic, I'm doing surgical safety and neurosurgery. And then I went into like further detail of patient safety in neurosurgery, which like the article I found was like the current state of how they're doing everything versus of what they would want to do in the future. And something I found interesting while like reading the article, it was saying that they can see a decrease. So they're saying that avoidance of like wrong site procedures, it happens between 25 and 35% of neurosurgeries. And whether it's like a brain surgery or a spinal surgery, that something always happens during the point of practicing the surgery. And that they're saying that the way to decrease this incident of like wrong site surgery is to like make sure they're preparing everything right during pre-op and making sure everything is like proceeding well during post-op surgeries as well.
Yeah, it sounds like an ounce of prevention is better than a pound of cure. So in my career, I've literally seen craniotomies done on the wrong side of the brain. They're trying to biopsy a tumor. This is a completely incompetent surgeon, by the way, and had multiple problems like this. So he did the craniotomy, he literally did an incision, took out a huge chunk of bone. He's supposed to be biopsying a brain lesion. He does intraoperative ultrasound, which is smart. They don't see anything. He can't figure out what's going on. Duh, you're looking on the wrong side of the brain. There are simple procedures to prevent that from ever happening. I mean, that should literally, and we've talked about this, never events, but that should never happen.
And I even think like making sure that you have like the scans up in the operating room so you know where you're going, like would help with the prevention of wrong site surgery too.
As easy as it is to criticize it, I'll give you a perfect example of a guy who I had a lot of, and I still have a lot of respect for, very smart, very talented, interventional radiologist. And as you guys know, I was a radiologist for 30 years. They were doing a biopsy. He ended up trying to do a biopsy on the wrong side, meaning it was a left-sided chest biopsy, but it was right. And the only thing that he had forgotten to figure out was, when he was figuring out what side to do it on, was whether the patient was prone or supine. So prone, face down, supine, back on the table. Well, how does that change the side?
Well, it flips your left and right.
Exactly. And he failed to figure that out. So he was doing the biopsy prone. So he was prepping, the exact wrong side, and only figured that out after the fact. So it's the simple problems that end up biting people. And so, you really need just tons of sort of basic principles of confirming and marking the site. As a matter of fact, when I had my surgery in the pre-op area for my cervical spine, literally my surgeon signed the side that he was going to be operating on. Literally his signature, Lou Jenis, Nick Argy, I'm operating on the right side to do this cervical fusion. So yeah, no, it's a hugely important topic. So anyway, thanks for the update. Anybody else now?
It wasn't on Kaiser, but I found that there's like a outbreak of bird flu in Maine. And basically like while it's not contagious to like humans, it's like spreading within the domestic and wild birds up there, and like it could affect our chicken. I don't know like if we have any vegetarians or not, but it's a good day to be vegetarian,
Yeah, no, it happens periodically that the entire poultry industry has gigantic outbreaks of avian flu, and they literally have to slaughter 1 million birds. I don't even know what they do with the meat other than dump it out and let it rot, which is terrible for global warming as well. But that happens periodically. To me, it's no different than a pandemic, except it involves fowl instead of human beings. So yeah, no, it's a problem. It's a problem for the food supply as well, for people who, they need protein in their diet. Chicken is an inexpensive means of getting protein, and it obviously disproportionately hurts the disadvantaged. So yeah, no, it's a real problem. I actually hadn't seen that, but it's a recurrent theme of and it sometimes happens in other animals as well. I'm trying to remember if it happens as much in pigs or cows. Well, yeah, it happens in cows with mad cow disease, where they have to slaughter tons of animals, because that's transmissible by eating the brain substance or contaminated substances. I'm sure it happens in swine. Nothing off the top of my head is coming through.
I actually misspoke, and it's like the outbreak happened in ducks, and then so people are afraid that it will spread to chickens.
So you really don't want to get ducked in this situation. That would be a really bad thing. So
Right.
yeah, no, and again, they're just trying to keep the food chain clean and healthy. And the worst thing is eating whatever contaminated lettuce, which seems to be happening more often than not, and getting sick because of it. So yeah, no, that's great. And your in your paper.
So my topic is inmate worker safety, and I recently found that in the United States, just the 50 states, that inmates only, on average, they only make from 14 cents to $1.41. So $1.41 being their highest an hour per hour, which was kind of, well, I know, like, I didn't know the numbers, but I knew it was super low, and that's just basically it. It's going okay. It hasn't been hard finding references. I'm trying to make an annotated bib, so that's where I'm at right now.
Yeah, that's fine. And I don't mind if you just use endnotes, that's fine by me, versus citing exactly in your paper where the stuff is. I mean, both are useful, but whatever works for you. I want to make sure you've done your homework, so that's great. Yeah, I mean, there's no shortage of literature on how horribly prisoners are treated and prison work. And I don't remember what the name of the movie was. What was the name of that phenomenal new movie? I think it got Oscars
Is
with.
it the documentary or the movie?
No, there was a movie about a prison, and it was the escape of, there was a white banker who was falsely accused of murder, and then who's the phenomenal black actor who was an inmate as well, and he was released prior to the white guy being released. No, he's released afterwards. The white guy escaped.
Is it Shawshank Redemption?
Oh, thank you so much, Monica. You rock. Yeah, it has everybody seen Shawshank Redemption? If you haven't, add it to your Netflix or whatever, if you use pirated sites, whatever you, but Shawshank Redemption is just excellent acting, excellent plot. I mean, really just telling about prison life and corruption of both the leadership and the guards. I mean, it's just a phenomenal movie. And definitely, the treatment of our prisoners is a huge public health problem. So anyway, yeah, I can't recommend enough Shawshank Redemption. Yeah, I would have remembered that. Thank you, Monica. Next, for a topic in your paper.
I can go. I read about, it wasn't in Kaiser, I think I was like on TikTok or something, then I looked it up after. The norovirus is like back and more contagious than it usually is,
I read
which I
that
thought
too.
was like really kind of, I don't want to get it. I don't like having stomach illnesses, but
Well, I think you should go on a cruise.
no.
Yeah,
No.
cruises are famous for norovirus, just because they literally, I don't know if anybody's been in a cruise in the past 10 years, but cruises literally, you walk around with hand sanitizers and wipes everywhere because it's just terrible. Like 3/4 of the cruise just sits there. Well, I don't mean to be graphic, I'll be graphic, puking and having diarrhea for your entire cruise. Because noroviruses are highly contagious. You're miserable, and you're spending $1,000 a day to be using the restroom and spilling your stomach contents. It's just so not cool. But yeah, norovirus is a huge problem, and I did read something about that. And don't hesitate to use anything beyond Kaiser Health News. I go through Kaiser Health News pretty religiously, but I also go through all the medical literature every day in terms of, not all, obviously, that I could spend an entire year on one day's medical literature, but I go through Kaiser Health News and look up the interesting stuff. I go through all the American Medical Association publications, JAMA, and I go through the New England Journal of Medicine, and then I go through literature reviews that the New England Journal of Medicine does. So I pretty much see everything that you guys are seeing. So feel free to go beyond Kaiser Health News and bring up stuff. And if you bring up a topic that I know nothing about, that's good too. I get to learn something new.
And then my paper topic, I was doing the mechanisms to fund children's health insurance, and I was looking at a chip still. Recently I was looking into like who CHIP covers, and it's the people who make too much money for Medicaid. And in some states it does cover the pregnant woman. That's just like, that was interesting to me. I want to figure out, like, they work hand in hand with Medicaid, but I'm trying to figure out why they can't just like permanently fund it. Still, I'm trying to figure out the reason.
So, the federal government contributes to it, but again,
Yeah.
each state determines the exact level of services and financing. So if you can come up with a proposal that seems to be like a balanced, reasonable, fair, best practices, that would help the whole cause. Oh, the other thing I wanted to bring up, thanks for reminding me, is if any of you want to publish your paper because it's timely and interesting and shows some best practices and want to work with me or not work with me, I'm happy to help. So, and again, as I said, I think I mentioned this earlier, it only helps in your, in your job search to say, oh, I published this article on this topic that I researched and presented to my my class on public health. So that's great. Cool. Who hasn't spoken?
I can go.
Perfect. Thank you, Keisha.
So for a topic I found interesting, I've been writing a paper for another class on healthcare disparities in oral healthcare for Medicaid patients and just, low-income adults in general in the United States. And so when I was looking up on the ADA, the American Dental Association website about reimbursement rates of Medicaid care versus private insurers, I found this amazing graphic that, how the percentages compared there. And when I was looking at Minnesota, their reimbursement rates for Medicaid dental care are absolutely horrible.
And I'm sure nobody takes it.
I have not been able to find a lot of research regarding who accepts it in the state, but when I'm looking at this report was published in October of 2021, so it's not very old. So, and I don't know if you guys know, but federal law requires all 50 states to cover children's dental care for Medicaid, but not adults. So, I mean, I'm not including the states that just don't cover adults at all. But when I was looking at Minnesota's health department website, trying to figure out why their reimbursement rates are 30% or under for Medicaid dental care, I found this reform that they actually passed in 2021, where they're working on limiting barriers for providers that want to sign up for providing care to Medicaid patients, but also how they're greatly increasing their reimbursement rates. So I would be interested to see in another year or so if the ADA puts out another report and what it looks like now, and if they actually have passed a real serious reform. I got curious about that state in particular because even their children's reimbursement rates are super low. And so, I'm curious to see if they improve.
Yeah, so oral health is second only to mental health in terms of horrible inadequacy. And I was just reading something, I think yesterday or today, about the fact that people's oral health when they hit 65 and start going on Medicare goes right down the tube, because most of those people were on private insurance, employer insurance, which covered dental, and then they lose it altogether because there is no dental coverage unless you're in Medicare Advantage for seniors. So it's a disgrace. I haven't seen any reasonable proposals. It absolutely needs to be included within comprehensive healthcare, oral health. So yeah, I couldn't agree with you more. How's your paper going on? I remember yours because I sent you some reference materials on IVF.
So one of the things I was curious is about Alabama law and the states that have all the reports I've been reading have said a couple of different states have explicitly stated that IVF care doesn't fall under abortion bans. And so I started looking up the Alabama laws, and Alabama, although I don't agree with it, is very explicit in their wording, and they leave nothing to interpretation, which I thought was a good thing for a state law to put in. For example, in their state law, they say that the pregnancy is only counted as a pregnancy if it is implanted in the uterus.
So that's very different than many states which say the embryo is alive at the time of fertilization.
Mm-hmm. Yeah, so they explicitly say that, people have brought up questions on whether implantations outside of the uterus would be in danger of jail time, for example, if they get an abortion because the pregnancy is not viable. But Alabama law has not only explicitly stated that those are not counted in this, but also IVF is not counted because the pregnancy is not inside the uterus.
Cool.
And then I thought it was interesting too, in their law, they specifically stated that you know, at the end of IVF, if you have leftover embryos, it's perfectly legal to dispose of embryos if you don't want to.
Again, a big difference than other states.
Huge
that's for
difference.
sure. Yeah, so very interesting. I like this topic a lot. You'll be educating all of us. Why don't we, it's almost 12:50. Why don't we take 5 minutes off, start just before 1, and we'll finish up the rest of the people for paper updates and topics of interest, and then we'll dive into the questions from this week. So I'm going to put this recording on pause and see you in 5 to 8 minutes. So I'm starting up the recording again. I had one topic that I wanted to discuss that I found of interest this week, but I'd like to finish up. Who, raise your hand if you haven't given us an update on. Okay, so we have 3 people. Great, yeah, go for it. Any one of you.
So my topic of interest was the shooting at Michigan State that happened last night. It was a 43-year-old man who had no association with the college at all, who killed 3, injured 5, and then killed himself.
So it's a great topic in the sense of how much of a problem are mass shootings in terms of the percentage of deaths due to firearms? Is it, I'll give you some choices. We'll start at 10 and then we'll work our way up. Mass shootings as the percentage of deaths associated with firearms: 10%, 20%, 30%, 40%, 50%, 60%. Okay, and I skewed it to trick you a little bit. It's under 5%. It's like 2%. It's just they get all the media. So we somehow think that even though mass shootings are common, in terms of the percentage of total firearm deaths, they're minuscule. It's like all the money we spend on terrorism and deaths associated with terrorist attacks, but they represent just a fraction of the actual. Sorry, if you think I'm looking down for a reason, I'll show you why. He wants attention. It's like, stop talking to those people and pet me. Come on, my tail's wagging. I love you. He puts his head on my lap, which just makes it particularly difficult. So I apologize for the interruption. So yeah, it is a problem. If you hate dogs, I'm sorry. If you love dogs, then you're welcome. It's a problem, but it's not the real problem. As we've already said, what are almost 2/3 of the deaths associated with firearms about?
Suicide.
So, and then half the times that I hear Biden talk about getting rid of assault rifles and all the victims and all the victims of mass shootings, especially the ones in California, where large clip handguns, which are illegal, I sit there going, what part of this do they not get? I mean, you know, almost all these mass shootings are associated with handguns with large clips. I mean, a Glock typically has anywhere from a 10 to 15 round clip, and you can buy extended clips that have like 25 rounds. You know, it's crazy. The other thing too that I think is important to recognize is the definitions of mass shootings are highly variable, but typically involve anywhere 2-3 people. What are the vast majority of mass shootings related to? Just random people going to, you know, Chinese New Year and shooting people up, random people, 43-year-olds at Michigan State killing 3 people and wounding 5 at a university. What are they overwhelmingly related to? Another huge public health.
Is it school shooting?
No, you know, interesting. That's what you would guess based on the media. It has nothing to do with school shootings. What is it? What's a huge problem that we screen for in healthcare all the time?
Mental health.
Mental health, and the next step is intimate partner violence, domestic violence. So huge numbers of shootings are, the vast majority of mass shootings are domestic violence. Again, what happens is when you guys are out in the world and you're listening to the media, understand the media is there to, and I hate to say this, but it's true, to entertain you and to get clicks and views and get your attention, but it may not be based in reality. It may just be based on what's going to get you interested and watching the material. So just be aware of that. So the Michigan shooting and your topic.
And then, so I'm doing my paper on postpartum psychosis. And right now I'm looking into the US's like healthcare system regarding treatment because it's messed up. And then Switzerland's treatment for postpartum psychosis because it's entirely different.
Yeah, I'm all ears. That's
So,
great.
I'm
Did you
looking
read
at-
any particular article that sort of revealed something to you new since last week?
So I actually found one, I believe it's actually in the US. Nope, just kidding. It's in Switzerland. They have a new app for new mothers to talk to their midwives and postpartum like care team in between like care visits, just so that the midwives and other nurses can like communicate with their patients in between visits to like check in and make sure that they're feeling all right regarding any form of postpartum mental health, which has actually proven like great results. Like it's prevented and helped a lot of new mothers managing any symptoms. So that's also a great intervention. And in Switzerland, the mothers are allowed to bring their child to the treatment centers for for their stays during treatment, so that they can still form that bond with their baby. Instead, where in the US, the moms can't bring the child to the treatment centers because they're not classified or considered as a patient. So they lose that bond, which like just makes the symptoms that they experience worse.
Yeah, it really highlights two issues. One, childcare is a problem in delivering optimal public health and the ability of people to provide for themselves if they had easy and affordable childcare options and high quality. The other question that I'd love, if you see any of it, I'd love to hear about is why the heck aren't we screening dads and finding out what's going on with dad's perception of how mom's doing and how the child's doing and what's going on? Because it's not only screening the mom, but it would be very curious if we could get some insight into when things aren't going right from dads or other caregivers within the scenario of a newborn. So yeah, no, really interesting topic, lots of possible solutions. Thanks. I think we have a couple more people.
My Kaiser topic was same as Jenny's. It was the doctors disappearing from emergency room. But something I guess I can add in that is so this case where the lady was pregnant and then she was bleeding, and so she went to ER. She thought it might be a miscarriage, and then she went to ER once, and then she got sent back.
I think that was from today, wasn't it? That was today's.
It was 13th.
Oh, okay, so yesterday's then, yeah. I remember reading it as well.
Okay, yeah, and then she got sent back because there's no doctor, and then 3 times she got sent back 3 times, and then later, like it was a miscarriage, and so the baby died. So I guess that ties on to the thing you were saying earlier. If it's a good thing to have PAs and nurses there instead of doctors in ER, because cases like this makes it complicated.
Well, think about it for whatever week I told you it was, where we talk about, I think we said it was week 9. Hang on, look at this here. No, it's later than week 9. Oops, sorry. This is my participants list is overlapping, so I can't see it. Yeah, it's week 9. So it's scope creep, safety or financial issues, scope creep, problem or solution. And again, there's 2 huge schools of thought. Doctors should see board certified doctors should see everybody, and the other camp, which says we need to provide better access to healthcare. And if we have quality trained and credentialed advanced clinical providers, that's more than adequate. So yeah, you're gonna sort of look at that and reflect on it. So I think it's a great topic. How's your paper going?
My paper is going pretty good. Something interesting that I didn't know, and maybe other people would find interesting too, is, oh, well, my paper is comparing healthcare financing in America and in Switzerland. So I found out that Switzerland does not have like a single payer health insurance, and it has like 82 different private health insurance. And somehow it is managed to not make it expensive for its citizens. I mean, everyone, honestly, even if you're not a citizen, if you go to Switzerland, you don't have to pay a ridiculous amount of, it covers everybody. And so with that 82 private health insurance, they provide like high standard of care. They don't have waiting lines, and people have freedom to choose about which insurance they want, which Americans really value, I guess, like choosing.
Yeah, I think it's a great topic. And again, it's interesting to me, and I'm looking forward to reading your paper and listening to your presentation, because Switzerland, my understanding, and you'll correct me if I'm wrong, is that they provide a voucher, and the voucher can be applied to any of those 82 private insurances. And if they have copays, they have copays or whatever. So you allow people who are affluent to purchase what they want, or even if they're not affluent, you're allowed to purchase what you want. You determine whether you want to spend your money on rent or a better healthcare insurance product. And they also have a national program as well. So you can opt for the national program, doesn't cost you a dime. And I think you last week or the week before talked about the fact that they will not allow you to spend more than whatever, 10% or 12%, whatever, there's a fixed amount. So yeah, no, it's interesting. And I think it's long overdue for us to be critically evaluating that. So yeah, that's terrific. I think is there one more person, or yeah, perfect. Sydney.
So on Kaiser News, I saw this article about how the two states that are left that don't have like a law on like safe driving without like texting and stuff are Missouri and Montana, and they've been like, there's been talk about them changing it over because of like how dangerous it is. Like, it doesn't say this in an article, but like I knew there's like a 3-second time window of when you look at your phone versus when you look back up at the road, and how long it takes for your eyes to like readjust. And so like, I personally have never gotten a text that's like more important than your life. So I feel like that's really important, because there's no need to be texting while you're driving.
But I'm just curious, just an informal poll. Raise your hand if you glance at your phone occasionally while you're driving. I think only 2 people didn't raise their hand. I do it all the time. And do I realize it's dangerous? Yeah, I do. It's almost addictive behavior. I'm glancing at my phone all the time. You know, is my mom okay? What's going on with my kids? Blah blah blah. So it's a huge issue. I can't tell you how many deaths there are. This is why autonomous driving and all these whether it be Tesla or a myriad of other companies for allowing autonomous driving is just going to save so many lives. All you keep hearing is, oh my God, it's going to be so dangerous if your car's driving itself. No, it's going to be so much safer if your car's driving itself, not more dangerous. But time will tell, and time will determine when it is infinitely more safe. But I think right now there are tons of autonomous trucks driving on major interstate thoroughfares to do that. Yeah, Monica, please.
I just wanted to ask, I don't know, I think I read this somewhere, it might be not true. Isn't New York shifting to all autonomous driving, like Ubers and cabs by 2030?
I wouldn't doubt it. I mean, it's going to happen. I'm 63. It'll almost certainly happen within my lifetime. It'll definitely happen. You will not be driving your car. You will be asked to sort of oversee and supervise. But it's going to be infinitely. I'll never forget. I had a service on my vehicle, so they gave me one of the newer models. I have a Toyota Tacoma truck, and it had these lane variance warnings I can't tell you. I mean, in the course of driving the car for 2 hours, I heard 500 you're not in your lane stuff. And so it just means that if you get within like 2 feet of either the center line or the edge line, it gives you a beep. I never even have paid attention to it because I've never been either on the other side of the road or off the road. But this thing is keeping you even in a narrower corridor. So yeah, it's a huge problem. And who do you think is fighting autonomous vehicles left and right who make a fortune from the fact that humans drive vehicles?
Like
Billions
truck
of dollars.
drivers.
No bigger industry than truck drivers that are absolutely miserable that we're going to have autonomous driving vehicles because they make billions because of it.
Uber.
Car insurance companies.
Car insurance companies are going to lose a fortune because accidents are going to go down 80 or 90%. So it's not only car insurance companies, it's auto body companies, it's all the companies associated with the fact that we're terrible drivers. And it's not our fault. We're humans. So we make mistakes. We're distracted. We're imperfect. We don't take in all the data and bad things happen. So anybody else on topics or papers? Oh, sorry. Did you do your paper? Who's...
No.
Oh, tell me about your paper. Sorry.
So I'm doing like physician assisted suicide as well as like the want to like die basically because of a terminal illness. And so I found this article and it kind of talks about like the desire. It's like the desire to want to go to a physician and be like, can I have a physician assisted suicide? Like things like that. So they did like, they found out what affects the patients more. And so I thought like a big factor would be the time, like, you know how they say like your certain time left to live, but apparently like whether it was 6 months or like 4 years, that didn't seem to matter as much, but like your age. So younger people, like if you were diagnosed terminally at a young age, that's a side effect. Worrying about one's physical appearance, which I thought was random and weird. And then loss of dignity ended up being a big thing. So like those who need help with bathing and like can't do things for themselves because of their terminal illness, their quality of life is like so depleted that they didn't want to live.
So I'll share a little personal vignette. I apologize for doing that, but I think it just exemplifies sort of different philosophies on this. So, you know, my desire to not be on this good earth is far more based on not being a burden to those around me. I mean, the last thing I want, and I'm not going to get graphic about it, but the last thing I want are my children taking care of me on every sort of basic fundamental level, especially if I'm bedridden. I'd so much rather be remembered as this, you know, somewhat entertaining professor who's carrying on conversations with the students rather than some bedridden person that my kids are taking care of. So that's far more important to me. I mean, you know, pain is pain and it's horrible and we don't want it and nobody wants it, but that's what morphine drips are for. But the concept of being dependent on people you love and being a burden to them, to me, is insufferable, you know, mentally. The other thing too is there's a tragic video. I should find it, or you can find it, of I think an 18-year-old girl who tried to commit suicide like 20 times. She had horrible depression. They tried every treatment known to man. None of them worked. She was miserable every minute of every day that she was alive. She applied, I think this was in the Netherlands, to the best of my ability. There's a YouTube on it. It's like beyond sad. Of this 18-year-old woman who said, look, I just want to, you know, I need to end my life. I'm absolutely miserable every day of my existence. And there's no medications, electroconvulsive therapy, 1,000 different antidepressants that are making me feel better. And they agreed. They had 2 independent psychiatrists evaluate her. They said, she's right. She's miserable. There's no effective treatment. She's done this. She didn't have a terminal disease. She was just absolutely miserable. And they allowed her to kill herself. And there's a videotape of her being injected and blah, 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 and just literally dying in front of your eyes at 18. Do people find that reprehensible or admirable or somewhere in between? Is that autonomy? Is that a failure of our system? What is that? If you don't have a quick answer, that's great. I asked the right question. It's not easy. I don't know the answer. I remember one of my colleagues at work telling me that a 14-year-old from Wellesley High School killed herself. She had tried at least 10 or 15 times previously, and she was in the exact same situation. And I didn't know whether to be miserable and sad, other than for the fact that she was miserable and sad and killed herself, or happy that her suffering was over. Since she lived a pained and miserable existence in spite of all the money in the world, loving parents, loving friends, yet she was chronically and miserably depressed. You would hope that we have better tools so that we can treat people in that situation, but that's just not always the case. So just gives you pause, gives you an opportunity to reflect on, is it terminal illness? Is it quality of life? Is it some combination thereof? So I think we're all caught up, and we can hit the questions so that you can answer those quickly and for this week. Oh, the topic that I wanted to briefly mention that nobody else mentioned was that from the Wall Street Journal, US begins allowing Medicaid money to be spent on food. Good idea, bad idea? Should it be, should we be spending it on medical care and to help with food? We need to.
I think it's a fantastic idea. I loved that article. I read the whole thing and I started doing more research on it. I did a project last semester on the availability and access to healthy food and health outcomes. And I mean, I know you talk about like food as medicine, but we can preach as much as we want to people about eating healthy, whole grains, vegetables, everything. But if they don't have any access to anything but processed food, nothing's ever going to change. So if it's allowable and it can be delivered in a safe and equitable manner, I think it's a great idea.
Anybody want to argue against that we should spend more money on primary care and not on food? Thank you, Keisha. I couldn't agree with you more. That's why I chose it as a topic to discuss, as the one that I found interesting. So let's talk about the broken healthcare delivery system. How did people like the articles that you were asked to read? Good, bad, indifferent? Let's just go over the questions then. That's great. There aren't many. I think there's, hang on. I think there's only two. Yeah, there's only two. This is an easy week. 2 questions to answer. So question 3 is, the readings indicate a multitude of problems. What are the top 3 causes of the dysfunctional system? So you get to choose whatever. There's no, you remember, on all my questions, there's no really wrong answers. There's just how you put the, how you prioritize them. And the second question, because you only get 2, are we spending money dedicated to healthcare appropriately to improve health? Where should it be spent? Maybe a topic we just talked about 2 minutes ago. So anybody want to weigh in on the multitude of problems and what are the top 3 causes of our dysfunctional system? So there were a bunch of different things, on. Oh, did anybody raise a hand? I didn't mean to interrupt. I was looking at the reading materials.
I was kind of thinking, like, in my opinion, money is like a really huge issue with our like healthcare system. It's the like sick care model and not a treat the illness and fix the world kind of issue.
Yeah, so if your goal is to parallel what I've been trying to teach for the past 5 weeks, you just succeeded. So the last article, which I can't believe how current it is. I'm trying to find it here. Hang on. There's a New England Journal of Medicine article that basically talks about, hang on. Geez, I can't find it. I'll find it right now. Hang on just a second. I'm going to click on it. Oh yeah, bro, can we reconcile profit and equitable just healthcare? It's not a New England Journal of Medicine article. It's a JAMA article. Salve lucrum, the existential threat of greed in US healthcare. Do people think that that's just wrong, that that's just not right? Or do you think there's a real problem of capitalism and profit in providing good healthcare?
one thing that I thought was funny over the years is that like when people talk about profit in healthcare, a lot of the time they're talking about somebody that like develops a new vaccine or develops a new healthcare appliance, for example. And of course, those people profit. Hopefully they're doing it for the making, healthcare better instead of making money. But I think that it's interesting to blame one person for the ruining of healthcare and the profiting off of it, but we don't talk about the insurance companies at all.
Yeah, no, it's so. Any thoughts from anybody other than Keisha, just to get the conversation expanding about pharma? I sent you two different articles on pharma, one on patent law and one on antitrust. So anybody other than Keisha to talk about the pharma articles? Amisa, are you chatting to us because you're muted, or are you chatting to a friend? Okay, yeah, no worries. I don't mean to embarrass you. I just wanted to. I saw your lips moving, and I'm thinking, oh, should I be hearing this better because she's muted? No worries. Sorry about that. Didn't mean to highlight you. I just saw your lips moving, so I thought maybe you wanted to comment. So you'll find that I'm very patient, waiting for people to participate. And I don't mind awkward silences. So if somebody needs to comment on pharma and the two articles you read. You even get bonus points if you said I didn't get a chance to read the two articles because you're at least participating and being honest. Anybody want to give a synopsis of what the patent article was about?
It was
Or maybe-
basically, sorry.
Yeah, please, thanks.
I would just, I mean, what I got from the patent article was that it's like describing this cycle that pharma puts out drugs and they capitalize off of them, and then that like inherently keeps the prices and profit coming in and prices for drugs, almost, I don't know how to describe it. Okay, I'm losing my train of thought.
No worries, no worries. So you hit the nail on the head. This is perfect. The bottom line is patents make sense. You want to encourage people to develop innovations and new products, and you want to then reward their innovation. They spent millions of dollars. They should have whatever, 8 years, 10 years, 12 years of exclusivity on it. And then it's open to everybody to use, and generics come out and the prices come down. The article highlights the fact that they are using really, they're called skinny patents. They literally changed the formulation, the mixture, the delivery system, so they can extend this 8, 10, 12-year protection almost infinitely, so that the generics don't come out until 5 or 10 years after their patent should expire. It's truly gaming the system. It's not to anybody's advantage except the companies that are making multiple billions of dollars. And I think is Humira the one that they brought up? Does anybody remember? Yeah, Humira was supposed to be like generic 2 or 3 years ago. They changed some of the solutions, the delivery system, the indications, whatever they could to just drag it on forever, which serves nobody's purpose. Well, other than if you're a stockholder or you're an administrator / executive of the company that's making the drug. So it's just truly horrible. And what about the antitrust article that came out? I sent you a Word document: broken healthcare system, insulin, pharma, capitalism, and antitrust. Anybody read that one? Other than Keisha and Amisa, because they've been great and participated. You guys are all great. I just want to get everybody participating. You want me to call on people? Because I will, but that just sucks. I'd much rather you guys just volunteer.
Well,
What was
they're
that
just
stuff? Oh, sorry. Oh my God. I was
Oh,
trying to
that's
get my
great.
information down before I like started talking and
No, no,
sounding.
no, it's fine. Please.
I was
do
like
me a
reading my
favor.
notes.
No, no, no.
Yeah.
Do me a favor. See,
I'm like trying to get the article up, like
No,
get
it's
the news up.
perfect. I couldn't agree with you more. I literally have them. If you always see me turning to the right, it's because I'm looking at all the articles myself in real time. Make this class easy. Open everything up. Look so that when I refer to something, you can glance over and look at it and go, "Oh yeah, I remember what I thought about that." So that's great. Yeah. So Jenny and Kylie both had comments. I'm looking forward to hearing both of them.
Well, they're just like essentially that article's pretty much trying to find a way to lower the cost of insulin, which I think is like a major public health problem because no one from like I think I saw something on Kaiser like a while ago that like the insulin cost was like $35 or something like that, which is like absurd because people need insulin to survive. I just with that kind of stuff, it's like I feel like for people who need access to it, it should be free to them. But like, of course, the medical reps are like, no, we want money because we made this product. Like, it's just a very
Yeah, no, and I guess the fundamental problem is, you know what? If I say, I'm not going to subsidize your purchase of a Porsche, nobody has any problem with that. You don't need a Porsche. Insulin, you die if you don't use it. You die if you try to allocate it because you can't afford it. I mean, there's a huge difference between death and convenience,
no,
Oh,
I totally agree with that. And I feel like with certain medications where it's a life or death situation and like you need that, I believe, and people can disagree with me about this, but I believe you should have free access to that. It should be encountered with your insurance plan.
Yeah, so Jenny, that just gets to the fundamental issue: is healthcare a right? So many drugs. It's not just insulin. So many drugs are the difference between
Inhalers.
life and death.
Yes,
I
Yeah,
need to-
inhalers.
asthma.
I could go
Do I
on a
need
whole
to
list.
breathe? But $300 for my inhaler?
Yeah,
I'll
no.
just like do
You
it myself.
Yeah, is that a personal anecdote, Kylie? You don't have to share. You can say none of your business, but it's just so accurate. I mean, there's
Well,
so many
like,
drugs out there.
yeah, well, I don't know. My family's lower income, so our insurance is always hopping around because my mom also changes her job a lot. So like sometimes I'll have to pay like the $300 up front for my inhaler. I remember paying it one day and I was like, wow, my check's down the drain right now. And then there's days that it's free because we're on Medicaid or something. But it really just depends on what insurance we have that month because my mom
Yeah.
just job hops sometimes.
Yeah, no. It's an absolute problem. You are a completely legitimate and clear example of how random and the entire system is. So the other thing is, unless I'm in a situation where I can afford what I need, I can afford the copays, but I'm always just beyond shocked about what some of the copays are and what is required. So for those of you who don't know, if you haven't used, hold on, I gotta remember what it is. What's the drug? Oh, GoodRx, but there's about 3 or 4 of them. GoodRx can save you a fortune. Monica, do you know of another one other than GoodRx?
Oh no, I was gonna say something about like why the insulin prices are probably so much in America.
Yeah, I'm all ears. What do you think?
Oh, so the article said that like there are only like 3 companies worldwide that make insulin, and then there are 3 pharmacy benefit managers, I guess, that also like act as middlemen and sell the insulin, and so they can put price however much they want. And so because there is no, I guess, competition, it's that kind of is capitalism too, like because capitalism drives competition, you have to lower the cost, but I don't know, it's weird.
Yeah, no, it is weird, and that's why you'll notice on the 7th bullet on one of your reading assignments, which is a Word document, and it talks about antitrust, is these quote unquote competing, and I think we all agree competition overwhelmingly is a good thing, but how effective is competition when there's price fixing or collusion of what the price should be? Totally undermines it. That's what an antitrust violation is. Price fixing is a per se violation of antitrust law, and there's plenty of that going on. And, you know, it just needs to be enforced vigorously. Because competition works, but when you only have 3 manufacturers of baby formula, or 3 manufacturers of insulin, and they all coincidentally raise their prices 20 or 30%, somebody should just be saying, no, that doesn't work. You can't all coincidentally raise your prices. Your expenses have increased. It's completely crazy. Trying to see what time it is. So we have 8 minutes left. How did people find I have to find the article. The Shrekley Awards, the awards by I gotta find them. Oh yeah, Shrekley Awards by the Lown Institute telling. Just look it up. I'm gonna wait 60 seconds so you can look at it and remember your thoughts on it. LownInstitute.org project/2022 Shrekley Awards. Anybody want to remind me who Shrekley was? We talked about him in a previous class. He's the guy who found this I want to say it's a tropical disease drug. Somebody can look it up while I'm talking about it. Somebody was actually nice enough in a previous class to remember his name, which is Shrekley. He's a guy. They were the only manufacturers of the drug. It kills millions of people and disables and injures millions of people. And because he realized there was an opportunity to buy the company and then charge whatever he wanted for the drug, to make a fortune, and that's exactly what he did. He ended up getting jailed for other issues, but he's the scumbag of scumbags. He can sue me because this is all recorded and it's going to be available for people to review, but he's a complete scumbag. You know, because he just was like, it's not about helping people to be free from disease or suffering. It's all about me making a ton of money. And everybody should make a fair and reasonable profit. That doesn't mean you need to gouge people or compromise their health. Anybody remember that Lown Institute article? I think they were the top 10.
Yeah, one's from New Hampshire, right? CMC.
Yeah. Catholic, wasn't it Catholic Medical Center?
Yeah, I've been there.
Hopefully not to this guy.
No.
Yeah, no, I mean, and I can't tell you how many times this happens. They promo somebody who's completely incompetent, but he's generating millions of dollars of revenue for the hospital. So yeah, here it is. And we're the only heart program in New Hampshire to offer it, with a picture of this guy sitting there smiling at you. More experience killing people. Thanks. We don't need that. Bye. You know, turn in your MD credentials and take up house painting. Anybody shocked by any of these things, or did they think like, yeah, I guess that's kind of par for the course? Because it was all about fraud. It was all about incompetence. Patients disqualified from hospital for financial assistance.
Well, reading that article, it reminded me about, I forget her name, but she's being sued right now for fraud for like creating a medical like testing kit to see like what disease you have, like
Yeah,
based
so
off
you're talking about Elizabeth Holmes?
Yes, that's who it is.
It's almost amazing that I actually sometimes remember some things. Yeah, so she was convicted. She's actually been sentenced to prison. They had a
they like pushed back her sentence. We were talking about this in my marketing class because of like false advertisement and all that stuff. But that I saw that she was pregnant, so they're waiting once she gives birth to go to prison. So I'm not sure when she's supposed to give birth, but I guess after that, that's when she's supposed to go to prison.
And I think she's still like a multi-millionaire. She used to be a billionaire.
Yeah.
But now she's just a multi-millionaire. And she's got attorneys up, down, and sideways to keep her out of jail. But thank God the jury said, yeah, this don't fly. And then there was highly controversial testimony. I've written about her on my blog site. I mean, she is a disgrace beyond disgraces. But it's it's all about people being sucked into, oh, I've got this new technology and I've got this new company and she's well spoken and she's blonde and she's attractive, and people just getting sucked into it. And I don't mean to be sexist, because if you're good looking and male, you also draw people in. So it has nothing to do with being male or female. It's just that we have a culture of, if you're reasonably articulate and you're attractive and you make a good appearance, people are just drawn in, and it's beyond tragic. We're 3 minutes from ending, so I'm just going to ask you guys, you have any questions? Can I help guide you? Can I make this class better? Yeah, does anybody in the last 3 minutes want to tell me how we make this better? You know, I've only gotten one response to the critical review. I mean, again, I want to get the advice and recommendations. And again, everybody gets 100 on the evaluation. No matter if you completely diss me or you completely say things are cool here. So everybody gets 100. I don't want you to feel like in any way this is punitive. And feel free to say, don't feel comfortable responding like somehow it might be held against you. It's not. It's actually held in your favor if you say, hey, make it better by doing this. And I do it by consensus, because if 5 people say we need more in-person classes and 5 people say we need less in-person, we're happy with Zoom. I don't know where to come out with that. Maybe we'll do a couple more in-person classes, but I'm all ears. Anybody? And again, these are all your personal opinions. I'm going to try to weigh the group's feelings about this. We've got 2/3 of the class here. Okay, are the updates reasonable and fair? Weekly updates? We're not doing it twice a week, we're doing it once a week. Is doing current events and talking about those issues reasonable and good, or would you rather have more didactic? Pretty much I've heard most people enjoy doing current events. I think it makes it real. It makes it like, hey, I'm reading about this is happening today. People were shot in Michigan. What are we going to do about this? Anything else that, again, I want to make it interesting, engaging, and fun. And I don't want to be paternalistic. I want to sort of say, hey, I'm trying to help you help yourselves to get to, drafts and presentations in class and the like. Anyway, we're done. Feel free to email me directly if you want. You guys are awesome. I appreciate your participation. I appreciate your everything you do for the class. And I'll talk to you in 2 days. You're stuck with me in 48 hours. And please feel free to submit all your questions. We've already answered them all today.
Thank you.
Take care.
Thank
Have a great
you.
one.
Have a good day.
You too. Be safe.
Get over yourself.
Thank you. I just want to make one quick point. Do you know that GoodRx isn't necessarily the best discount card available?
So you know what? Send that out to the group. There's a bunch of them. There's like at least 3 or 4.
Yeah, but some that people might not know about is AARP and AAA are both discount cards, and they both discount far more than ones that GoodRx do.
Oh, well, that's great information. Send it out to the class.
I used to work at CVS, and I actually left the company because they told us we weren't allowed to tell patients that anymore.
Well, which is just completely unethical. It's foul. Completely foul.
I was watching my patients.
So AAA discounts, and what's the other one?
So
AAA,
AARP.
AARP. Okay, cool. Yeah,
They both work as pharmacy discount cards.
But you have to be a member of AAA or you have to be a member of AARP.
Mm-hmm.
I'm a member of AAA, so that's fine. I'll use it.
Yeah. And honestly, some of my patients that had, and the unfortunate thing is you can't use it in conjunction with insurance. So you can't